We want to turn now to coronavirus, the crisis in India right now. You've heard likely a lot about this. Infections rising by at least 300,000 cases every day for the past 13 days straight or so. At least 220,000 people dying, more than 3.5 million people currently being treated, and they think the numbers could be even higher than that. A friend of the show, Dr. Ajay Punyugadi, is a hospitalist with Franciscan Health Indianapolis. He's from India. He joins us now with help and heartache for his home country. Doctor, it's so good to see you again. We consider you one of our great friends. We want to start with talking to you about your mom is in India. A lot of your family is there. Your father passed away in July from COVID in India. How is your family doing and how are you holding up?
It's very hard to stay away from 10,000 miles when your mother is alone there and seeing a pandemic rip through your motherland. It's very hard. And not just me, a lot of Hoosiers, a lot of people of Indian origin in Indianapolis are losing a lot of their family members, friends, and they can't even do much about it because they can't fly there. And so we all are a little bit praying to God every day to make sure things come back soon.
You have
in a better place.
Yeah, you have such a strong, amazing spirit, one that in the middle of everything you've been going through, you're in that hospital every day, saving lives, and now also trying to gain more attention for those in your home country. Can you tell us a little bit about what is needed and so far how you and how others and even your hospital have gotten supplies to those in India?
See, India is about 1.2 billion people. And you're talking about America, which is about 1/4 of the population. You look at the ICU, number of beds is about 70,000 in the country here. In India, here is about 53, and you add the CCU beds is about 70,000. So you have same number of beds for 1/4 amount of people. And there's lack of oxygen in India at present time. It might get better in the future. So we are trying to raise money for these oxygen concentrators because a lot of people who have mild to moderate COVID disease doesn't really need too much of oxygen to take a bed in the hospital, especially when there's so much need for oxygen and hospital beds. So we're trying to raise funds to get some oxygen concentrators. And you got to know that a lot of people in India cannot really afford health care. So we're trying to provide some money to people who are really needy and poor. And so we're coming together. And not only the people of Indian origin, but, you know, we're only 1% of population here. 99% of the population are not from Indian origin. That's why I want to make this be aware to all Americans. And we know Americans are the most generous people. No matter what they go through, they always are very sensitive to other people. And they've shown up, and I'm sure they're going to help us through this, as this is a global pandemic. So. Yeah.
We're almost out of time. We have about 45 seconds left, but I know that it was important. We saw some of the photos really quickly of you holding one and then a vehicle with two others in there. I think Franciscan, I think they helped, and some of the doctors too. I know that was important for you to kind of share how other people are helping. We're going to put a link also to the site of where folks can help. Give me that final 30 seconds of what you want people that are watching. What can we do to help you and those in India? Because like you said, Hoosiers and Americans want to be able to give back.
Well, number one, pray for India. Number two, if any one of you have any oxygen concentrators that you are not using, you can message us at India Association of Indianapolis Facebook, or my Facebook is a public platform. You can message me, or you can even message any local organization that's collecting these things like temples, like Gurdwaras, whoever is involved in COVID relief in India. And you guys have probably don't know how important these are, because every breath you can give these to these poor and needy in India who are just dying because of lack of basic necessity like access to oxygen. You will be doing something for, and it will be a noble cause for you. Wow. And please do whatever you can. We all coming out of the pandemic. We all in a tough situation, but I'm still sure there's still some space in our heart that we can share with other people.
AJ, we love you and your family. We're thinking about you, and we appreciate your time this morning. I just got word from Daniel, too. It looks like multiple states are going to be going into complete lockdown here in the coming days.
Thank you
That's
so
been
much,
alerted.
Angela.
Yeah,
Thank you so much.
absolutely. If you'd like more information again on how to help with the India Association of Indianapolis, we link you to their page, and there's this place right there that you can donate and help out. Fox59.com/Angela Answers. Jim, you can just feel.
Oh, yeah.
I mean,
Strong man.
Oh.